Hi, everyone. How's everybody? It's Dr. Latowski. Can you guys hear me? Let's see. Let me go to the chat here. Okay. There we go. Can you guys hear me? If you guys want to just say in the chat if you can. Ooh, Jan already posted a question. Thank you, Jan. I am going to answer that in a bit. Whoops. 1 second. Hi, everyone. It's Dr. Latowski. Can you guys hear me? Oops. Okay, I'm going to get started. Hopefully you can hear me. And we'll just, let's see. Well, someone just tell me if you can't hear me. So let me exit out of here and exit out of here. And, oh, hi, everyone. Can you guys hear me? Ah, yay. Okay. And I have a note that chat is disabled. We are doing this webinar today for the first time with our executive assistant, Johanna. So we really, really appreciate her. And it's the first time she has done this. So thank you for bearing with us. And I told her if we have some technical difficulties, it's absolutely okay. So thank you everyone for your understanding. And I'm so excited you're here. We are doing a treatment today, or a presentation today on Agnes radiofrequency with microneedling. And who would like to have surgery without the surgery? Who would like to get the results of surgery, I should say, without the surgery? I would, because I don't want surgery, but I want the results. So this is what we're talking about today. And Denise wants that as well. Thank you, Denise. Great participation. So Agnes RF, we added this device to our office because, in my opinion, this device can give us results that are close to surgery. Surgery is still the gold standard for some things, but we can do a lot of things in a very easy and safe way with this Agnes RF. So what is it? Agnes RF, and RF again, it stands for radio frequency, is an innovative cutting-edge treatment that uses radio frequency microneedling technology. And as mentioned, it safely and effectively will lift the skin and it will tighten the skin. And so no surgery here, but it gives you those lifting results, those tightening results, and the downtime is surprisingly little. Basically, a few days of swelling and chance of bruising. So when all this is happening, Agnes also stimulates the collagen. And if you have been listening to my webinars, you know that collagen stimulation results in this beautiful, youthful glow of the skin. So we are doing a lot of things with a single treatment. I'm going to tell you more information. Okay, so the Agnes improves laxity. So if you guys look at our social media, we had this little teaser that we made up this morning. We're having a lot of fun with doing some new stuff. So the teaser was, do you want to decrease crepey skin around the eyes? Do you want to get rid of your double chin? Do you want to tighten the lower face, including the jowls? Agnes can do all of these. Agnes RF is a technology where we choose a small area to treat and we really focus on it, and we can sculpt the area. It's kind of like being Michelangelo, which is really inspiring. We can sculpt this area of the face, of the body, and we can get rid of excess fat. It's kind of like when Michelangelo is carving the David. He starts with a block of marble and he is sculpting it and chiseling it, and we can do the same thing with the Agnes. The increased collagen improves the skin texture, the skin smoothness. We reduce fat pockets. So again, that is the sculpting. We're improving fine lines and wrinkling. We're tightening skin. When we tighten skin, we're going to pull back the face. We get some lift with this treatment. And when we lift the lower face, we're also lifting the neck, by the way. When we tighten the neck, we also oftentimes improve the jowls. So even though we're choosing bits and pieces to treat, we're really having an all over global effect of the face and neck and or body. And that's what's really, really cool about Agnes. And it's very hard to photograph, by the way, because it is a complete 3D sort of change, not changing how you look, but changing you to a more youthful version of yourself. Okay, so the aging process. Over time, your skin is going to lose its youthfulness. Why? We're losing collagen. That makes the skin saggier and it makes the skin less resilient. It makes the skin fall. Collagen is analogous to a really tight coil underneath your skin. It's holding it in place. As it loosens, as it ages, your skin's going to fall down. Gravity is going to push it down. It's going to collect here in the jowls. It's going to collect in the neck. We don't like it. The decreased collagen also leads to like a crepe paper texture around the eyes. Crepe paper texture drives us crazy. We're creasing when we smile. It drives us crazy, and we can treat it with this technology. So aging also actually starts very young, actually in our 20s, but we start really noticing it, believe it or not, in our 30s. And yes, I do have 30-something-year-olds coming in and doing treatment. And when I first started practicing in private practice in 2009, I would have thought that was crazy. Now I am thrilled to accept patients in their 30s, and we don't do anything major. I'm not sending them for surgery. I'm not changing the way they look. I am doing preventative things that will slow down the way they age. Prevention in medicine is always better, always easier. It sets us up for success, including in our aging process. In our 40s, we are getting collagen and elastin breaking down more quickly. We're starting to notice that change in texture. I know I am. I'm noticing this change in texture right here when I'm smiling. We're getting fat loss in our face. It's the only place on our body that we want fat is right here to provide support for the face. And then because of the loss of structure, collagen, etc., we get the jowls. They're just starting to appear at this age. 50s and 60s, all of those things are becoming more prominent, and we're accelerating our bone loss because of hormonal changes. And then again, without bone, the skin just kind of pools, the skin and the fat kind of pools in this area. I just want to say something else. I mentioned patients in their 30s. It is also never too late to do an anti-aging process. I treat patients of all ages. I have even treated patients for anti-aging in their 90s, and these patients are pleased, by the way. And the most important thing, I think, is just realizing you're not going to look like you're in your 20s anymore, maybe for the 30-something-year-olds, but for most of us, we just want to look really great as we age. We want to be confident. We want to look like ourselves, but we don't want to feel old. We feel great inside. We want to feel great when we look at the outside. And so you will see a few before and afters of patients in their 80s on this presentation. And I want to tell you, it is never too late to get started. Okay, so this is a little bit about what I have just told you, but this is a pictorial view. And you can see we're losing bone, we're losing the tight skin over time, and everything's falling forward, and that skin is collecting in our jowl. jowl area, and it drives us crazy. In addition to the jowl area, that's kind of like the deeper change. The more superficial change is that texture change, that crepiness, the sun damage on the surface. All of these things can be addressed with the Agnes. Here's an example of collagen loss. Look at when we're 30 years old, we've already lost 10% of our collagen. So again, kudos to the 30-something-year-olds who are out there doing preventative treatment. They're just slowing down their aging process a little bit. But even at 50 years old, 30% loss, okay, we can manage that. And older than that, we absolutely can do things. So going back to the Agnes. This device combines radio frequency and microneedling. So basically, the energy source is the radio frequency. That is delivered through this teeny tiny little needle, hence the microneedle. So there's this tiny needle, it goes into the skin, and when we press the button, the energy goes down through the skin. That creates heat. That heat produces collagen, and the collagen will tighten the skin. And the heat also diffuses down to the deeper layers, which also produces a tightening and a lifting. In addition, there's another technique. So that's technique number one, skin tightening and lifting. Technique number two is fat treatment. So we can use the same device and we use it in a different way. Again, this is the sculptor coming out, and we're treating extra fat, double chin, excess fat along the jawline, excess fat in the jowls. We tone it down a little bit. Today, you are actually going to see our nurse Maya treat my extra fat in my knees. We thought we'd just shake it up a little bit. So we're going to do a body treatment today. But she is going to treat the fat in my knees. But also, I have a lot of laxity in my knees. And many of you have heard me talk about this before. It used to be so severe that I was not wearing shorts, I was not wearing dresses or skirts without tights. Now I can do it, but I want to do a little maintenance and I want to improve the changes that we already have. So we were just taking pictures and I contracted my legs. I saw some extra skin there. We want to tighten that. We want to treat the fat pockets around my knees. So this treatment can be used in that area. It can be used in the bra fat, but most often we use it around the eyes, the lower face, and the neck. One thing that distinguishes the Agnes, and I have another slide on this, but one thing that distinguishes the Agnes from other microneedling devices out there is that it is something called monopolar. So monopolar allows us to be very precise and also be a little bit more aggressive because we are being precise. And that means this device is going to give you a really reliable treatment. And that is why we chose the Agnes over other RF devices that are out there. Let me go on to the next slide because I think some of my, let's see. So just a little sidetrack here. Here's the chart I was thinking of. So here we have the Agnes, here we have Morpheus 8, here we have traditional microneedling. Traditional microneedling, I love it. It's very safe, it's very effective. Please do not do it at home, but we can do it for you in the office. It's extremely effective. And if you look on our website, I have before and after pictures that are amazing with acne scars, skin rejuvenation. But it does not have heat. And so when we add the heat in the form of RF, it increases the intensity. And when we have the increased intensity, we have increased results. Of course, the more intense it is, the higher the risk. Still very safe treatment, but RF microneedling has more potential side effects than traditional microneedling. So again, you want to make sure that you're going to someone that you trust for these treatments. So in this diagram, you can see that, for instance, Morpheus 8, they both have microneedles. They both stimulate collagen because they're using radio frequency, and the microneedles, they target in a deep plane. The Agnes also selectively destroys oil glands. So this was actually developed by a Korean dermatologist for the treatment of acne. His passion was to eliminate acne. So this can be treated for acne. We're not talking about that today. We can use it around the eyes. Why? Because it's monopolar and it's so precise. We can also, this is not on this diagram, but I might add it after today. We can also reduce fat with this technology. Morpheus 8, yes, it can reduce fat, but usually that's a side effect. So again, less precise, and I have seen side effects of Morpheus 8 causing fat loss. Again, beyond the scope of this presentation, we don't have the Morpheus 8. There's nothing wrong with it. If you've ever had the treatments done, it's actually a great treatment, but the Agnes RF can do different things and produce the results we're talking about today. So I'm going to go back. So with the Agnes, I can deliver concentrated energy very precisely to targeted areas, and this will create a more youthful appearance. And it's not just looking at a picture and seeing a line and having the line go away. This is sculpting the face so the facial appearance appears more youthful, like you used to look 5 or so years ago, maybe even longer. We are not injuring the top layer of the skin. So we're going deep here to get that really great tightening results, and when we need it, the fat reduction. So that's why we don't have much downtime. The top layer of the skin is left almost completely intact. Why is it not completely intact? Because we go through it with a little tiny needle. So that will create additional tightening, but because the needle is so small, very little downtime, and very predictable downtime with this technology. Okay, so here is another cartoon of this treatment. You can see on the far left hand that is schematic of the treatment itself. So you see these teeny tiny little needles going in there, and the little fire, if you will, coming out. That's the RF treatment. And so in this picture, they're going to reduce fat in her chin area, the double chin area. And so they're going into the fat layer, they're producing that energy, and that results in a decrease of the fat pocket there. So on the face and neck, there are 3 main areas where we use Agnes. Number 1, crepey skin on the upper and lower eyelids. This is so great because think of that tissue paper like quality to that skin. This is like just kind of spreading that tissue paper tight. And then as the skin ages, it gets droopier, of course. So you will see in some of these photos that even after a single treatment, the droopy skin will actually make the eyes look open more, and patients can actually feel that difference. That's the number one thing after they had their eyes treated by us, is they come in and they say, I just feel like I am more awake. They don't have the weight of those eyelids coming down. And then next would be eye bags. So because of the fat targeting, we can actually reduce the amount of the eye bags. Again, surgery is the gold standard for this. And I am happy to talk to you about that. We don't do the surgery in our office, but I can refer you to some trusted colleagues for that. So if you're not a surgery person, you want to treat the bags, this is really, in my opinion, the only other way to do it. Face and neck, you can do the double chin. That will reduce this. That will tighten the skin here. It will tighten the jawline, rejuvenate the whole area. Again, when you tighten the jawline, it helps the jowls. When we tighten the lower face, it makes the upper face look better. So if there's less saggy skin back here, it actually accentuates the cheeks. So you see the cheeks, you see the cheekbones, and it just has this different look, this more youthful look to your face after treatment. And then as you see, body contouring, so stubborn fat pockets, which is what we're going to be treating today on my knee area, bra fat, etc. So again, the strengths are there's not significant downtime, usually 4 days of swelling in the lower face area, and then perhaps some bruising around the eyes. There is definitely a chance of black eye. So 1 to 2 weeks around the eyes is what I tell patients to expect. Sometimes we don't get bruising and we're thrilled. If we do get bruising, and I've told them 1 to 2 weeks, then we just know that, we just have to wait it out. This area, we have patients, or this treatment, we have patients avoid sun before and after, but we're not as picky about it as when we're doing a laser. And again, this is because it's not light like a laser is, it's RF, and we're going to the deeper layers of the skin. So we're bypassing most of the top layers of the skin where the melanocytes, or the cells that make color, live. So when patients come back in 2 weeks, we see improvement. And actually, we see improvement during treatment, but I never show patients the mirror during treatment because we inject lidocaine before treatment, and it makes that whole area very puffy. So when they're puffy, they can't see the improvement. But in 2 weeks, we can see improvement, and the results will improve over the next 6 months. And I think actually over the next year, now that we've had this device since July of 2022, I think it actually takes a whole year for the face to kind of restructure in that Michelangelo way. But you see most of the results, I would say, in the first 3 months. We went over this slide and we talked about this. Again, we put some topical numbing on you, then we inject a little bit of lidocaine underneath the surface of the skin. You feel nothing during the procedure. Or if we're getting close to coloring outside the lines, you might feel a little something, but you should really be comfortable during the procedure. Afterwards, you really don't experience much discomfort. Most patients will just say, if they touch their skin, it's a little uncomfortable, just like if they have a bruise or something. And that area might feel numb to the touch for a few weeks. We talked about this. There's really no post-op instructions. The magic is happening underneath the skin. So we don't have to worry much about the top of the skin. We just say no makeup for 2 days, maybe minimize exercise for 2 days to avoid bruising and excess swelling. But after that, we're not super picky about your downtime. Ice will reduce the amount of swelling if you want to do it. If not, that's fine. Okay, so let's go to the before and afters. Here is a picture of one of the first patients I did with around the eyes. She texted me multiple times after this and said this has been life-changing for her. So you see her eye looks more open, although the result is very natural. You see there's less creases around the eye. Can you appreciate that the texture is better in the after picture? And that is making the whole area look less creased and wrinkled, but it's really because the skin is super strong. Think of someone smiling like in their 50s, 60s compared to a 20-year-old smiling. 50s, 60s, even if they've had Botox, they're making creases here, whereas 20-year-old skin is not really creasing that much here. It's kind of analogous to these results we're getting. Not as dramatic as that, but you can see that by increasing the strength of the skin, it increases or it decreases the wrinkling there. So again, patient, we just did her upper eyelids, and you can see she looks more alert, and her eyes just look more awake. She looks more youthful. Here's a side view. This is a patient who told me she just feels like she looks more awake and her eyes feel less heavy. And you can see why. So that was after one treatment. So here's another patient. She had 2 treatments. And you can see her lower face jowl area. Now we were just treating the jowl area because those jowls are driving her crazy. And you can see after each treatment, they're getting smaller and smaller. So think of the jowls, or think of these areas as like a 3D like block of marble. and we are shaping that block of marble. We're, in this case, decreasing the size. So when you think about it that way, you see the size of her jowls is less. And then look at her overall facial shape. We are noticing her cheeks more in the last photo than the first photo. The first photo, her face looks kind of square. I'm noticing the creases here more. The last photo, she looks a bit more feminine. Her face does not look square. And I see her really pretty apples of her cheeks and her really, really pretty cheekbones. Same patient, side view, so you can appreciate the shrinkage of the jowls. And then that helps define the jawline, and it helps to accentuate the cheeks. So see, in the first picture, we're not really noticing her cheeks because our eye is drawn to the lower face. Third picture, everything's tighter in the lower face. Her jawline's more defined, and then we're noticing her cheeks. Here is a young, beautiful patient. She had a genetically full face. And so we've actually done 2 treatments, but this is 1 year after 1 treatment. This is just to show you what 1 treatment can do. So look in the first photo. She's very beautiful. She's got, though, kind of a square face, which is a little bit more masculine. And again, this is genetic. And so we treated her at 4 months. You can see she's looking good. Definitely see she's less square, more heart-shaped in her face. Look at the 1 year. Look how we can really notice her cheekbones, and her lower face is much less. That's why, you know, looking at photos like these, and we have extensive photos that I have reviewed in depth with my staff, with the company of the Agnes, and I really think these results continue for a year of like tissue remodeling, similar to like when there is a wound in the skin, it takes a year to heal. So same patient, look at the definition in her jawline after the treatment. Even though her cheeks were not treated, look how we can notice her cheeks more after a treatment with the Agnes, because we've tightened her lower face and we've thinned the lower face a little bit. So this is an example of fat treatment throughout the lower face, around the jawline, and a little bit of skin tightening. She needed less skin tightening, more fat reduction. And this is, again, where our artistic ability can come in, because we tailor this during your treatment. Here's another patient. And I would love to have a little bit of a closer view for you, but look at her lower face. We simply did her jowl area. And you can see, look at the little wrinkles on the left around the jowl area. Look at the skin texture and tightening on the right. This was after a single treatment, and she said it was the easiest anti-aging treatment she's ever done. In addition, look at how her face has restructured. In the treatment after, I'm looking more at her cheekbones. She looks like she has more of a heart-shaped face than a square-shaped face. And she said this was extremely easy for her. So here's another patient. Again, you can appreciate skin texture, tightness. Look at those fine lines in the smile line area, and look after the treatment. Her skin looks rejuvenated. Her skin looks tighter, and she's thrilled she doesn't have those lines at rest anymore. Another patient, look at her lower face. Look how much tighter her lower face is, and that makes her cheeks just pop. And again, tighter lower face, better jawline definition. And even though we did her lower face, look at her neck, how it looks tighter, because we've tightened this area. It's pulling her lower face. Okay, here's another male who's had a treatment done, and look at the treatment in his lower face. He also had neck. Look at the tightening in his neck. Look at the lines in his lower face. Look how he looks thinner in the after photo. And of course, more youthful, because his neck is way tighter. You can see it here, but even along the jawline, you see how it's tighter. This patient was treated by our nurse, Maya, who's also going to treat us today. Or treat me today. Here's another patient. Look, we treated her neck, but look at her lower face. Look at those lines. By treating her neck, it's also pulled back her jowls a little bit, and less crinkly, crepey, the neck is tighter. And I believe this is the patient I'm thinking of. We've done 1 or 2 more treatments since then, and her results are even better. So for this patient, we are decreasing fat without causing lax skin. So some treatments, such as, in fact, I love all fat treatments for the double chin. I love cool sculpting. I love Kybella. I do those 2 treatments. This treatment, however, the fat that needed to be removed, I was worried that there was going to be some loose skin there. And so we did this treatment so we would get the fat reduction plus the skin tightening. And you can see, look at that. It looks like she's lost a lot of weight, 30 pounds or so. And then look at how her cheeks are accentuated, even though we haven't touched the rest of her face. We literally have just done this and tightened up here. You can see that she just looks more youthful. You can imagine she looks more feminine. She looks like she lost a lot of weight. Same thing here. Look at how her cheeks have just popped because I've tightened her lower face, and that has helped the jowl area. And actually, I just tightened the neck, which in turn tightened the lower face, which leads to better cheek recognition, more feminine look. She's absolutely thrilled. We just did another treatment, and I think she's just going to love it. So here is a patient who had her neck treated. She did 1 treatment. You can see in the absence of anything else, she had pretty good tightening of her neck and that texture. Look at the texture right underneath her chin. Look how much tighter that is there. Now, if she would have allowed me to do a little filler in the sides of her neck, I could have significantly tightened the rest of the neck skin that is there, but she didn't want to do that. She's thrilled with her results. Same patient, side view. She is absolutely thrilled with her results. Look at the crepiness and texture in the first picture. And now it's like super firm. I wish I could put a little Botox in her neck bands, but she still looks great. And her jawline is more defined as well. Okay, thank you guys so much for sitting through this. As your reward, you're all going to be entered into a raffle. And you will get, these are actually 3 of my favorite products. I love these products. I'm kind of jealous. You're going to get an eye mask. My 13-year-old son and I will lay at home at nighttime and put these eye masks on. We love them. And then my favorite cleanser, really nice, beautiful exfoliating cleanser, and this really nice eye cream from SkinMedica. So you will get that. Here are your promos. So the first promo is a treatment of the lower face, including the jowls. And you'll get your post-care kit. You will get your SkinMedica TNS serum. And that is our favorite serum. If we had to choose one product, we'd take this to a desert island because it contains antioxidants, growth factors. It will rejuvenate your skin even if you do nothing else. So it just makes it brighter, slows down the aging process, neutralizes damage. The second treatment is lower face, including the jowls and the neck. So you are going to get a lot of skin tightening and jaw definition, plus the SkinMedica, and you have significant savings on those. And then finally, we have it all. We have the eyelid tightening treatments. We've got the lower face with gels. We've got the neck. This is the one I would choose because I feel like I could use this treatment in all 3 areas, and really most people could. So we're going to tighten the crepey skin, that tissue paper skin around the neck, pull back the jowls, and pull back the neck. And the promo is $4,500. You save the most on that one. For each of these, this treatment takes Maya and I a significant amount of time to do, especially the 3rd level, the full revitalization package. That's going to take us a lot of time. So there's only 10 of these available, of each of these. And then these cannot be combined with other promos. And then again, because of the time constraint, the promos are final sale and non-refundable. So now she's going to treat me. And we did numb before this treatment. I'm going to turn off the camera while we switch positions and I get in the treatment area, and I'll be right back. So for those of you who don't know, this is Maya, our nurse, and she and I perform a lot of these treatments. Dr. Yonan also performs these treatments. We absolutely love this treatment. And so before beforehand, before the webinar, we numbed this area. So we injected some lidocaine and we marked out the area. So there's 2 areas we're going to treat: the fat pads that she's marked, and then also the skin tightening. Do you want to close up a little bit? So here are our markings. All right, go ahead and take it away, Maya. So, perfect.
Start here.
All right.
We'll test to make sure you're feeling okay.
Okay. Feels good. All right, guys. Wish me luck. Mhm. So, completely painless because we've numbed. I'm only feeling pressure. And like I said, if she starts coloring a little bit outside the lines, I might start to feel something. I'll give her that feedback, and then she'll either go more towards the numbing area or she will add more numbing. This fat portion, like I said, you see results in 2 weeks, but it will take a good 4 months for the fat to go away. So I never repeat a treatment before 3 or 4 months, unless we absolutely know we're going to do 2 treatments. Then maybe I'll wait 6 or 8 weeks. But if we do a couple treatments, then we will be doing, you know, several months in between. In this area, I am going to expect bruising, although probably not a ton of bruising. There might be a little bit of soreness. There will probably be some swelling maybe in the knee area for like a week. One thing that's really cool about treating this area, if you reduce the fat in the inner knee area, it actually makes the rest of the thigh look better. So by doing this, my inner thighs are going to look smaller in proportion because we're kind of tapering the leg as it goes down to the knee. And so it creates this really nice profile for the thigh. So this is a really great secret. You don't even have to treat the inner thigh in most patients. And one reason why sometimes we don't treat the inner thigh is because that skin can get very lax, very crepey. And so that would be another reason to do the Agnes in that area, probably just for the skin tightening in that area. Are there any questions? If you guys have any questions, type them into the chat. Okay, so someone asked, does Agnes help to resurface the skin? So here's what it will do. It will rejuvenate the skin. The skin will glow. It will look healthier. The pores will be smaller. Why? Because it produces new collagen. When you produce new collagen, you get all those things. You get the tightness, you get the lifting, you get the pore reduction, you get the youthful glow. But it will not help with brown spots on the skin because we're only affecting a little bit of the surface area of the very top layer of skin. So if someone has a lot of brown spots, wants more resurfacing, I recommend doing a Fraxel laser, and we can use the wavelength 1927 nanometers to resurface the skin. The results are amazing. I've done webinars on these on Fraxel, and we can even combine. In fact, I tried to talk Maya into Fraxeling today. She said no. She said I was being too ambitious, but I was going to have her Fraxel over the top of this to get the resurfacing effects too. Probably stay a little bit more medial or lateral. Okay, so that's the question there about resurfacing. And any other questions? I thought there was one question at the beginning. Oh, that was that one. Okay, you guys, thank you so much for watching. You can see this is completely painless, and I'm so excited for my results. So if you want to see a facial treatment, I am going to have our staff post on our YouTube, and we'll send you the link. We'll post on the YouTube a picture of me treating Haley, the model, with the lower face tightening. So we've been there, done that, and we'll post that on YouTube so you can review that at your leisure. Is there one more question?
We have a comment.
Comment.
One of our before and after results, she said she wanted to add that her neck kept improving. It looks even better than the very last pic that we showed.
Oh my gosh, thank you so much. Thank you. So the comment was, and you guys, I guess, can read it, but she agrees that the before and afters, they keep improving. The after keeps improving even after she said her neck looks even better than what we had shown in the photo. So thank you for that. All right, guys. Well, thank you so much for tuning in. And oh, one more question. Sorry.
What should the timing be before/after I have my Botox in my neck?
I love that question. Thank you so much. I would say 2 weeks. So 2 weeks after neck Botox. And actually, I know I've told a lot of you this, but when you have Botox in an area that's being treated, whether it's Agnes, whether it's Fraxel, you will heal better with the Botox in place than not in place, because with any sort of wound healing, the stiller the skin is as it's healing, the better it will heal. That's why if someone has a skin cancer surgery, we tell them not to exercise that limb or that body area for 2 weeks. That's why sometimes after a Mohs procedure that Dr. Ogridge does, I will put a little bit of Botox around the surgical wound. It's actually been proven by studies that that improves the healing. And so the same goes with cosmetic treatments too. So great question. Thank you for asking. Thank you guys so much for tuning in. And we'll be sure and send you some before and afters of my treatment today. Thank you.